Christmas is a time to spend with loved ones, but for some people, the holidays can be draining on their mental health. You may have heard the claim that suicides increase during this time of year. Lisa Lucas is looking into whether that's true in tonight's Verify report.
December offers a dose of holiday cheer, but the season is not merry and bright for everyone. Concern circulates online with claims the suicide rate increases during the holiday. But is that true? Our sources are the CDC, the Annenberg Public Policy Center, and Dr. Valdesha Dejan with the Georgia Psychological Treatment Center. Despite popular belief, the CDC reports the suicide rate is actually the lowest in December, peaking in spring and fall. The data proving the online claims false. Annenberg Research Director Dan Romer has tracked the myth over the years.
Year after year, there were more stories that supported it than debunked it until this last year.
According to Romer, spreading the myth can have contagious effects.
We don't want people to get the idea that if they are currently in a crisis, that this is something that other people are using as a solution to their crises.
What I tend to see is a lot of holiday grief. Maybe loved ones have passed away throughout that year. Also, family dynamics that may be dysfunctional or difficult family members to interact with becomes a problem.
The reality, the CDC reports suicide is the 10th leading cause of death, taking more than 47,000 lives every single year. So there are signs to always be wary of.
Drastic changes in the person's appearance. Do they have morbid thoughts? Sometimes they will let us know where they are emotionally. And then last, sometimes people will isolate themselves and be more withdrawn. So these are good signals for us to hone into when we have loved ones that are depressed.
If you or someone you know is having suicidal thoughts, please call the National Suicide Prevention Lifeline. Someone is available 24 hours a day.